Hi, I'm Dr. Jen, board-certified general surgeon with a passion for surgical wellness, a concept I created to care for the whole patient. Surgery is hard on the mind and the body. And if you or someone you know is having surgery and you want to give them a gift to show that you care, don't waste money on flowers. Get them something that's actually going to help them feel better. I created the Set for Surgery care package that takes into account the nuances and the subtleties of surgery that the patient is going to experience that only the surgeon knows. The first product is melatonin. Sleep is essential to functioning well in our daily lives, and very few of us do it well. Add in the stress and the heaviness of disease, injury, and surgery, and you're going to sleep even worse. However, sleeping better will improve your surgical outcomes. It will improve how your pain is felt and how you heal. It will also help with the anxiety going into surgery and coming out of it. Sleep is essential. I chose melatonin because it's a safe product, it's a naturally occurring hormone, and in the liquid form, it's better absorbed. I also like the dropper because you can decide how much is best for you, more or less. The next product is a probiotic. The bacteria in your gut have an enormous influence over you as a person. They affect how you sleep, handle anxiety, handle pain. And when you have antibiotics, either before surgery to fight an infection or during surgery to lower your risk of surgical infection, your gut is going to be affected. So show those bugs some love and give them a probiotic that is specific for the bacteria in your gut that has had to deal with antibiotics. The next product is a tea tree skin salve. The skin is the largest organ in the human body, and we ignore it and we abuse it, burning it under the sun, tattooing it. So let's show the skin some love and hydrate it. The skin salve will do that. It will also lower the number of bacteria that are on the skin, therefore decreasing or lowering the risk of infection when the surgeon makes that cut. The next product is an electrolyte drink. The rule of nothing to eat or drink after midnight, the day of surgery, is a torture of the past. What we've found is that when our patients are better hydrated, they handle the stress of surgery better. They're less nauseous and their pain is better controlled. And they feel better overall. The way I have patients take this is to have it finished and in their system 2 hours before they're to arrive at the hospital. So if they're supposed to be at the hospital at 9 a.m., this needs to be in them by 7 a.m. Those 2 hours give the stomach time to empty the drink into the intestine, and then the anesthesia provider isn't worried about having contents in the stomach during surgery. That can be dangerous. But when this is taken properly and with the right timing, it's a game changer. The next product is a sore throat spray. One of the most common complaints after surgery is a sore throat from the breathing tube. If we numb the throat before we actually insert the tube, the nerves will be less irritated. So I have my patients use a sore throat spray before they go back to the operating room. Now my anesthesia providers know this and they're okay with it, so be sure to ask yours. But this low volume throat spray will numb your throat before that breathing tube goes down. You'll feel better afterwards. This next product is an all-natural lip balm. When you're in the operating room, sometimes for several hours at a time, no one's moisturizing your lips and you're certainly not aware that they're getting dry. I have patients put this on when they're in the hospital waiting to go back to the operating room, and then I have them ask the anesthesia provider if they wouldn't mind putting on the lip balm during surgery every once in a while. These little details will help you feel better and have a better surgical experience. This product is a hot cold press. Now I chose this particular size because I want these to be placed in areas of the body away from the surgery site that most people don't know are affected by surgery. As an example, the IV sites. Veins have feelings, they have nerves, and it hurts to have an IV put in or taken out. So use this for an IV site anywhere, on the hand, the arm. Sometimes we even have to put an IV on the foot, which is incredibly uncomfortable. So this can help. The other way that these can be used is behind the shoulders, elbows, hips, knees, or feet. When you're lying in the operating room, on the operating room table, not moving for several hours, you get sore. Now, we put a lot of effort into padding those, what we call pressure points, where your weight is against the table. But still, after being there for several hours in the same position, you're sore. You can put these back there and treat those areas. I hope that the information you've heard today will help you, your loved one, or a friend have a better surgical experience. If you have any questions or any interest in surgical wellness beyond what we've discussed today, please reach out. Thanks.